The Asian American Pacific Islander Nurses Association of Nevada presents Healthy Mondays with AAPINA of Nevada. Start the week healthy and right with interesting conversations on living a healthy lifestyle. And now, your Healthy Mondays host, Dr. Marife Armstrong.
Hello! Magandang gabi po sa inyong lahat. Maraming salamat po sa inyong pakikinig sa aming programa. I'm yours truly, Dr. Marife Armstrong, founding president of the Asian American Pacific Islander Nurse Association of Nevada and professor at Roseland University College of Nursing. So thank you for listening to us this Monday night. And every Monday is a special Monday for me. And just a recap, last week we were able to interview our 3 male nursing students from the Valley and a tribute for men in nursing and also men's health. So tonight, because July is actually HIV/AIDS Awareness Month, and specifically, I think it's the last 2 weeks of July is the HIV Awareness Week. So I have a very special guest tonight. She's a good friend of mine and colleague from the Substance Abuse and Mental Health Service Administration's Minority Fellowship Program. I have, let me just read her bio, and very impressive. So Dr. Schola Matovu is an adjunct assistant professor at University of California, San Francisco, and she's also a postdoctoral fellow in the Betty Irene Moore School of Nursing at UC Davis. For more than 18 years now, Dr. Matovu has derived great professional satisfaction in caring for patients in nursing homes, hospitals, skilled nursing facilities, and in-home settings. As an alumna, as I mentioned, for the SAMHSA and Minority Fellowship Program, her foundational research focused on the promotion of mental and physical health, psychosocial well-being, and quality of life of grandparents who care for their grandchildren, particularly those affected by HIV/AIDS in Uganda. As an advocate for the nursing profession, Dr. Matovu is also a co-founder of the Nurse to Nurse Global Initiative. It's a nonprofit organization whose mission is to empower nurses in global community in seeking professional development that enhances their growth and promotes the health and dignity of the patient populations that they serve. So welcome to Healthy Mondays, Dr.
Thank
Schola
you.
Matovu.
Thank you for having me. Thank you for having me, Dr. Armstrong.
I'm so excited. We haven't seen each other. I love your headpiece.
Thank you.
Sorry about your headpiece.
I am embracing my roots one head wrap at a time in this lockdown time. So, I'm rediscovering that passion for head wraps, I guess.
So, can you share with us a little about personal background? You know, your humble beginnings as a nurse professional.
Well, I was born and raised in Uganda and raised by my grandmother. And that was really the formative influence. She was the formative influence for my personal, but certainly my professional experience and interest in nursing and now in research. She took care of a lot of family members and a lot of community members, providing different kind of remedies for fevers and colds and delivered babies. And so as a little child, I wanted to grow up and emulate this woman who was revered by her community as a Musao, which is an equivalent of a health profession or nurse or doctor, but she was not formally trained for that. And so I grew up interested in that area, and certainly I experienced firsthand the poverty in Uganda growing up and how the impact of the HIV/AIDS epidemic impacted different populations in this environment. And so when I decided to pursue my profession, but also advancement in my education. I wanted to, look at an area that I'm passionate about, an area that was personal and, had meaning for me, especially if you are to pursue a terminal degree. And so when I sought out to seek my PhD, I wanted to focus on grandparents to get a better understanding of what their experiences are, regardless of what the socioeconomic status was. But the HIV became a major factor in terms of how much it has impacted the world, but particularly sub-Saharan Africa. And so it became a part of my interest.
Yes, it's such a novel topic to talk about, the poverty, and then here comes a virus that's really affecting, which is rampant in Uganda, in Africa.
Right.
I just wanted to share with our listeners out there how Dr. Matovu and I met each other is in one of our intensive summer intensive training for the SAMHSA Minority Fellows scholars. And little bit did we know that there's an affiliation with the Uganda Christian University in Mukono that I was teaching, and that was Madame Jemima Matubasi, right?
Yes, yes, yes. Now retired, but definitely not tired, as she says.
Yeah, she's such a, I wanted to do a shout out to Madame Jemima there, so all the way to Uganda.
Yeah,
So,
she's been very impactful in terms of the nursing profession in Uganda and continues to be. In fact, we're writing a manuscript together currently. So she's a great leader, nursing leader.
how exciting. Well, going back to our topic tonight, because July, once again, for our listeners out there who just joined us, the month of July is considered HIV/AIDS Awareness Month. And Dr. Schola Matovu is our special guest tonight, and she gave some story about her passion for her current research topic. I think it's more on focusing on psychosocial well-being of grandparent caregivers for children who are impacted by HIV/AIDS. So maybe you can start off with sharing with us a little bit about your research topic, and then we can segue into your passion about helping the caregivers.
Right. Well, this is certainly an area that is very close and dear to my heart for the reasons that I've provided. Um, I'd like to kind of give you a little bit of background about this area. We know that grandparents everywhere, no matter the culture or the setting, they're revered individuals and who provide the comfort and wisdom and love and, nurturing for their youngest generations of grandchildren. And in most cases, even in the United States, you find that grandparents love to spoil their grandchildren and then send them back to their parents. And it's a beautiful thing. And unfortunately, for some grandparents, they are forced, really, it's an inherent obligation to care for their grandchildren in a primary role, especially in the absence of the middle generation. And there are many factors all over the globe that have created this context. For example, in the United States, this context, particularly within ethnic minority groups, particularly African Americans and many others, but in that population, the concept of grandparenting became that much more evident during the crack epidemic, where that a lot of grandparents became primary caregivers in the absence of their adult children as a result of this really social injustice that was the mass incarceration of their adult children and substance abuse. And so that, then created a unique context in which grandparents took on this responsibility as primary caregivers or custodial grandparents. And in so many cases, no matter where, no matter what context, they are providing these, caregiving with very minimal resources. In the Ugandan context, for sure, the extreme poverty, as a context in which individuals provide care is really significant. In the US, we may have some issues around access to care or, other issues that may surround the inability to, access available resources. In sub-Saharan Africa, particularly in Uganda or any other under-resourced areas, individuals are born and they grow up and they age in extreme poverty without formal employment, without jobs, formal education, and so they have no resources whatsoever. And so they depend on the social network. And therefore, in the absence of that social network, which is primarily the middle age that most impacted by HIV, between the age of 15 and 49 as the highest prevalence for HIV, you find that these individuals don't have the network, the support they need. And so they become really the safety net, and really they carry on this labor of love that is the care for their grandchildren with such extreme difficulty. And there's been a lot of psychological, emotional, physical, financial and social challenges that are faced by this population. So it is no matter what the context, whether it's HIV, we can't even imagine what the COVID-19, how it has impacted this population in particular. But no matter what the socioeconomic factors are that then predetermine the situations into which these grandparents care for their grandchildren, these older individuals continue to be the support that is needed by their families to support the younger generations with such difficulty.
I just wanted to interject, Dr. Matovu. Uh, for our listeners out there, I know we are saying that July is the HIV/AIDS Awareness Month. We
Mhm.
are. I'm a very strong advocate for mind, body, and spirit. So I know that there are a lot of information already out there about the HIV/AIDS in a pathophysiology aspect. So tonight we are looking at the the emotional aspect, not necessarily on the individual who have HIV and AIDS, but mostly for the caregivers. You know, a
Mhm.
lot of times we forget about the caregivers. And you mentioned about safety net and the middle age. That's quite the difference between the sub-Saharan population and the population in the US. Maybe you can give us some statistics about what you found out in your research. Was there any comparison between what's happening in the US versus what's happening in the sub-Saharan Africa communities?
I see. Well, when it comes to the HIV epidemic, we know that there's been a lot, really dramatic improvement in terms of one, how we view HIV as an infection, and not looking at HIV/AIDS as uh, a terminal illness as it had been once considered. We're seeing a lot of improvement in terms of, especially in sub-Saharan Africa, we're seeing a lot of improvement, especially of people dying of the disease in particular because of the increased use of, antiviral therapy within this population. And so we are seeing those improvements. However, the sub-Saharan Africa population continues to be the most impacted, with about 68% of those living with HIV globally being in this environment. Globally, we have about 37.9 people who are living with HIV. 68% of those are in sub-Saharan Africa. In Eastern sub-Saharan Africa, we have about 800,000 new infections. And when you compare those to the US, where we have about 3,600 or 3,700 of those, we can already see the differences in the numbers in terms of people overall living with HIV. Again, in East and Southern Africa, we have about 19.6 million people, at least by 2018 we did, and compare that to the about 1.2 million people in the US who are living with the disease. And so in the US, it might not be as much of the burden on this particular group of caregivers, as caused by the HIV, but more of the other socioeconomic factors now that are coming up. But within Uganda in particular, for sure, we so far we have about 600,000 orphans who have been created by this epidemic. And again, in the absence of that middle generation, grandparents take on the burden of caring for the children. So even though we see improvements as far as HIV is concerned, and the mortality rates decreasing, we continue to have a lot of need in terms of supporting the families of those who are impacted by HIV, those who are, infected may have decreased productivity at work, or other issues surrounding infections that may not, you know, allow them to take care of their families effectively. And so they rely on the grandparents to care for their grandchildren. So, yes, in spite of the improvements that we've seen in the HIV, era, but we still have a lot to do in terms of support and access to resources.
I just wanted to, when I was interviewing the male nursing students last week, and emphasizing that also what's happening in one country is affecting another country, and it's so timely that this end COVID-19 global pandemic demonstrated that so
Yeah.
much that we cannot isolate ourselves from other countries, so that we need to pay attention to what's happening around the world. So I know in the Philippines, because we're talking about caregivers and we're talking about grandparents, I know in the Philippines, when you turn 60 you are encouraged to retire, and that there is a certain age limit where you don't have any chance to secure employment. I mean, it's different in the United States. You can work until you die, but in other countries. So I wanted to, since you are familiar with the sub-Saharan Uganda, how about in Uganda? Is there any age limit for a grandparent? For
For this group of
individuals? Yeah.
Yeah, unfortunately, I have to say that the majority of individuals in this cohort have never had any kind of formal employment anyway. When you look at the lives of most of these, for example, grandmothers, they were married off at very young ages to often older gentlemen, and they became homemakers. They take care of their families, while the men provide for the families, taking on jobs outside the home. And due to either polygamous practices or death of their spouses, then they are cast in this position where they have now to figure out how they can take care of their families without a husband, without an education, without formal employment. And so for the majority of them, really, they embark on, you know, odd jobs, whether it's selling produce, whether it's, peddling items, produce or clothing. We use clothing. And so there is really no demarcation in terms of the years of retirement for the majority of them. Having said that, for the few who may be able to retire on 65 or 60, still don't have access to most of their pension, due to different issues, corruption and other factors that may come into play. And so really the retirement age, or age at which you can thrive and enjoy your family, is not as important, because it doesn't apply to the majority of this older population.
We kind of digress a little bit with that, because I think what I was trying to do is kind of point out to our listeners out there about the limited resources. Now you have middle-aged parents who really pass away from contracting HIV and AIDS, and now their children are now being taken care of by their parents, who are now older individuals, who are now grandparents. And
Right.
so it's really um, something that can be compared to where I came from, my culture in the Philippines. That's why I was trying to digress in there, that how could these grandparents take care of their grandchildren when they themselves need help?
Absolutely.
So yeah, and so looking at what kind of resources, what kind of resources that we can provide for these communities, whether it's in the Philippines, whether it's here in the United States, or whether it is in Uganda. So
Right.
it's something that was explored during your research studies.
I see. Well, so regardless of the setting, and what you, I think, referring to is, how can we adapt interventions that can, target needs, support needs of this population, no matter where they are. We know that they have to be driven by the needs, of course, of the grandparents. What are the most needs for them? In most of the low resourced areas, and I would assume maybe some part of the Philippines is that way as well. Really, it's the basic needs: shelter, food for their families, clean water. I mean, the most basic, needs that we take for granted, especially in the United States. I remember going back while I was doing my research in Uganda and looking at the dire needs where a grandparent is working and farming on a land for somebody else for hours, just to get a few potatoes to take care of their families. And so it does not require that much, but we have to be able to look at support that is sustainable, whether it's through teaching them skills. The majority of the grandparents in Uganda, I don't know much about the Philippines, but I would assume it was around agriculture, especially for rural dwelling populations. And so, teaching them, effective farming methods that can be able to support them and sustain their livelihoods. We have to think about psychosocial support, whether it's through counseling, which is a little bit of a cultural concept that is foreign in some areas, but looking at ways into which these older individuals can be able to share their experiences and learn from each other. And then, work in support groups or community-based groups to be able to support each other within their communities. So those are some of the areas that we have, or at least at this point I'm looking at in terms of identifying effective ways that are driven by the grandparents, in which they can be supported. The other area, of course, is caring for their grandchildren's needs, particularly tuition. Unlike in the US where they might be able to have access to free education, that's not the case in some parts of the world. So they have to be able to, educate their grandchildren. Like my grandmother always said, they know that in the end, our success as their grandchildren is their success, because then we get to take care of them in their older age. And so ways in which you can improve, ways in which they can provide for their grandchildren, pay for their tuition and education, provide them for their needs, clothing. And so those are different ways in which we can be able to support them, but they have to be sustainable as well, and they have to be community based.
And also, because their parents, this grandchildren's parents had contracted HIV and AIDS. So, and we both know that sometimes it doesn't surface until later on. Maybe they are carriers already, and then later on, these children that they are taking care of, maybe later on they will test positive.
Mm-hmm.
And so the grandparents, caregivers are also exposed to that.
Right.
So those are so many opportunities for us to provide education and awareness to the community. And you mentioned about how it is in the Philippines, how we can help the grandparents who probably are taking care of their grandchildren, whether they have they have a history of HIV and AIDS, just to share about the community resources. And sometimes they have what they call cooperativa, where the government will give some funding for the little barrios or communities for the grandparents to learn new skills like cooking, maybe cooking simple snacks, and then they'll be able to sell it. So there is one another way for them to provide for their grandchildren.
Yeah, for sure. And you bring up an important area there, or point, Dr. Armstrong, about the grandparents themselves being infected with HIV and having to deal with their own illnesses, or access to medication treatment, but also the grandchildren being infected. And so without, for example, proper meal for these children to eat with their HIV medications, adherence to those medications becomes a problem. And again, not only the grandchildren, but the grandparents themselves. And so providing livelihoods that can sustain them in terms of providing food, nutrition, and basic needs is really important. And you're right, education is definitely important. For now, I think grandparents are much more aware, and there's a lot of work that has been done in terms of educating them around the importance of adherence, and HIV not being a life sentence as it used to be. And so people are aware, and there's not as much stigma attached to the HIV. as it used to be in the early 80s, 90s. People now are very much aware. They just have to look in terms of how can I support my family going forward, or support myself, having the right food to eat, doing exercises, or, any other ways in which they can be able to promote their own health and maintain their own health is critical.
And then having that being provided the basic needs is also preventing them from being they're already immunocompromised with
Right.
the disease itself, and then if they are not getting enough nutrition, they're not, and they are stressed about when are we going to eat next. And the medications, I think, for the most part, all these years that I'm coming back and forth to Uganda, I see that some of my Masters of Science nursing students share with me that the community has now a lot of resources. They have now places where they can go for testing, and then if they tested positive, they are now being followed up by social workers or even nurses, and being guided and educated of what are the things that they need to do to prevent it from spreading, like using um, uh,
Disease,
using
abstinence, and yeah.
yes, students, or and giving away condoms. I remember our group, our students, we were looking at educating, sexual education for the children in the orphanage in the church that we went to. We were very careful because it's a church and you don't want to do teaching about that, but it is necessary for
Right.
prevention, right? So the students had gone and bought some condoms to give to the older children.
Yeah.
And at the orphanage that we went to. So there are a lot of opportunities, and I think um, it's more on looking at what are the needs for our local communities. Related to, since we're talking about HIV and AIDS, although you were saying it's no longer like a certificate for death when you're diagnosed, because now there are a lot of upgraded, new medications. And I know there's this medication where you only take it one day, and then the testing too, the lab tests are not that numerous like before. Also, now and COVID, the coronavirus is now taken over the popularity of versus the HIV and AIDS. So, and even when we're talking about the COVID coronavirus global pandemic here, we always go back to basics.
Right.
You mentioned about eating nutritious foods, healthy foods, exercising, getting enough sleep.
Exactly. And I have to point out that, the access to those services, yes, it might be much more available now, but those who are in rural areas, who don't really have any access to those services are impacted a lot, no matter where you're looking at. And so we normally assume that those services are very much available to most. But for example, and that might be the case in the Philippines as well. Individuals in the villages and don't have that access to those services. Either have to travel long distances, and that means not working, not being able to get food for their families that day. They have to be able to access any kind of services that may be available in urban settings. So there's still some challenges that are unique to certain settings, for sure.
Transportation is a big issue.
Yeah.
The resources are available, but then they have to go there. So in my thinking, because we were planning, and I'm going to digress a little bit, because I'm looking at how we can help our communities. I know that one of the passion I have is international mission trip. We were supposed to go to the Philippines this December. And last January, I went back to my hometown to look at, what are the little planning that we do, and we have to ride the boat going to one of the communities that we wanted to reach. We can ask them to come in and go into the main proper town to get some free medical help and free medications, but what about those who cannot walk?
Exactly.
Those are immobile. So Same thing with reaching out to our communities who have high prevalence of HIV and AIDS. Um, those are the things that we have to look at. Transportation is really a big thing.
Yeah. Yeah, and definitely, in terms of accessing care in these areas, well, that's in the world, nurses are the largest workforce. And so investing in nursing is really critical because you prepare them to be able to serve and the communities in which they come from. And so those nurses, if we are investing more into, community based interventions. For example, having nurses or nursing students travel to the villages to be able to provide education, treatment or testing to these, groups that may not have access is really critical. So, as much as we focus on the individuals who are impacted with HIV, we have to use the resources, and that is the nurses. But if they're not prepared enough, they don't have the resources, they're not empowered enough, as the case in most of these parts of the world, where really nurses, even though they are the largest workforce, don't have the empowerment, they don't feel confident enough to make the difference in their communities, then it defeats the purpose. So that's another area in which we can focus into capacity building and empowerment of nurses in these communities.
Yeah, the other, yeah, that's really great. That to empower the nurses. You and I are nurses, so we have to empower our young generation. To have the passion to serve the community. Whether with our topic right now, HIV and AIDS, in any situation. That's what why I became nurses, right? To help others. But one thing that strike me with all of the discussion that we have at the end of the day, even if we have all the resources, we have transportation, but there's still this stigma.
Yeah.
I think that I had heard about it when I was talking to my students in Uganda about, yes, doctor, there's a lot of resources. However, once they tested positive, they don't share the information because of the stigma. Can you
Mhm.
speak to that? How what you know about that?
I'm sure there's a certain amount of stigma that still exists, though it's not as major or significant as it was in the beginning of this epidemic in the 80s and 90s. Some of them, especially older, individuals who are losing multiple adult children to HIV. There is more kind of a cultural stigma, if I may, where grandparents may be perceived as have been cursed, to have all their children, or not being able to, raise their children with morals, to prevent them from easily catching HIV. So there may be some of that stigma that is still existent in the communities, but not largely around having the infection. But as it is here today, of course, there is concern about disclosure, making sure that individuals, even in America here or other places, their status, is their, personal information that needs to be protected, that may not be as, rigorous, in other areas or in other countries. And so there is a certain amount of stigma for sure that is still attached to the illness.
And because of that holistic view of nursing care, um, the individuals still carry those cultural, values and its stigma. So we know that we have a lot of here in Nevada, we have a lot of population, African population. There's an African community center that I
Mhm.
had taken some of my students for clinical in the previous institution when I was teaching, and
Yeah.
so it's very important for our nursing students in our community to understand those cultural values and cultural stigma in order for them to better, in order for us to better serve them and to better help them as nurses, as healthcare providers. So you're so true about the curse, that I'm being punished because I did something wrong in the past. And it's true with a lot of cultures. In
Absolutely. Absolutely. And that's why, again, as a nursing profession, we pride ourselves in providing that holistic care, being able to look as the individual as a whole, their families, their culture, their belief system, and be able to provide the care, but also the support they need based on what those needs are that are specific to their needs. So, it's an area that we are proud to be able to achieve in our profession.
I really enjoy our discussion, Schola. Dr. Matovu, thank you for your expertise and your insights about our topic, HIV/AIDS and the caregivers. It's a little twist because I know that I interviewed Dr. Austin Nation. He's another co-fellow from the SAMHSA. I
Yeah.
think it was last year or the year before, probably last year. We talked about specifically the HIV and AIDS and how you contract it and what are the signs and symptoms and the testing and follow up. But this tonight we were able to have Dr. Matovu to talk about the caregivers. We often forgot about the caregivers who's taking care of the ones who are left behind
Exactly.
after the individual's body just give up because of the disease, because of the virus. So time flies when we're having fun. Covered a lot, and I think our listeners out there, I hope that you pick up some information, important information for yourselves or for your loved ones or someone you know who may have been suffering from HIV and AIDS, and then also their caregivers. So I hope that we were able to give you some important information. That's why we have Healthy Mondays with AAPINA of Nevada to give you this important information. Thank you again.
Thank you for having me. This was exciting.
Thank you again, PHLV Radio, for your partnership. And I know that information every Healthy Mondays that we bring to you are important information that you pick a few things that can help you in your daily routine. So thank you again. And our listeners out there, remember, every Monday is a Healthy Monday. Aloha.
The Asian American Pacific Islander Nurses Association of Nevada has just brought you Healthy Mondays with AAPINA of Nevada.